Welcome back, East Texas. We're joined now by MARI-CARMEN with the CHRISTUS Trinity Mother Frances Health System. Thank you so much for being here today.
Thanks for having me.
And it is May 1st, which is actually Stroke Awareness Month.
Yeah.
So how common are strokes?
So about almost 800,000 stroke patients happen a year in the United States. It's very, very common. It's the 5th leading cause of disability in the United States. It's the 1st leading cause of disability and the 5th leading cause of death. So it's very prevalent. It's a really tough thing to crack.
Is this an issue actually in our area here in East Texas?
Absolutely. We live kind of in the buckle of the stroke belt, which means lots of high blood pressure, lots of diabetes, lots of obesity in our area that contributes to stroke specifically.
So does this vary by age? Is one age group more prone or something like that, or is anybody at risk?
You know, as you get older, in your 60s, stroke is more prevalent, but as you've seen in the news most recently, it can hit at any age, really. We've had 20-year-olds, 50-year-olds, even teenagers that have had strokes from different undiagnosed cardiac problems or high blood pressure, things like that.
I feel like sometimes people don't typically expect a stroke to happen. Do you know any of the signs that one might occur?
Absolutely. We used to go by FAST, which was face, arm, speech, and time to call 911. But now the American Stroke Association and well, I can't think of the other name. We'll just go past that. They're talking about using BFAST, which considers balance and eyes, which are super important in the posterior circulation in the back of the brain, where all that can be affected. As they, you know, it's not the symptoms that happen often, but they're very detrimental when they do happen. So that balance, eyes, face, facial weakness, weakness on one arm or the other, difficulty speaking, and then it's time to call 911. It's an emergency. Although strokes don't hurt, they can cause serious damage, and the farther out you get from the time that the symptoms began, the less we can do for the patient to make them better. It's all very time sensitive, so no naps, no resting to see if it'll get better. 911 is where we need to go.
Very scary stuff. If people are interested in learning more about this, do you guys have any events coming up this month?
We do. We're actually going to open our Dr. Thomas's garden on 4 Ornelas, which is the neuro unit in the stroke facility. We're actually going to open it into a therapy garden where our physical and occupational therapists can take you out there and work with your hands to get in the garden, planting flowers, watering flowers, getting better by doing some hands-on therapy. And then we're going to have a Strokes for Strokes. We've worked with the American Stroke Association and the Genentech is a company that we use for some of our medications, and we're partnering together with the Willowbrook on May 30th. We're going to have a guest speaker who's a really, really great speaker about stroke and all the ways that we can prevent those things. And then we'll have some door prizes and a special recognition for one of our stroke survivors, and also the Stroke Team of the Year from our hospital. So it's really exciting stuff. I'll be out in the community a lot this month trying to make sure everybody knows what the risks are and how each of us can prevent that from happening to us.
Absolutely. It sounds like a great educational event.
Yeah.
Thank you so much for being here, MARI-CARMEN.
Thank you.
All right, coming up after the break.